Good morning, colleagues. Today, I will be presenting on how artificial intelligence is fundamentally transforming thoracic surgery. I'm Isra bin Shafir from the National Higher School of Artificial Intelligence, and over the next 7 minutes, we'll explore how AI is revolutionizing every aspect of case surgery, from preoperative planning to post-operative care. So, what we'll dig into? Mainly, we'll cover three critical areas today. First, we'll establish the medical context and AI fundamentals. Second, we'll walk through the development process. And third, we'll just examine real world applications that are already changing thoracic surgical practice. And before we begin, let me ask you this question. How many of you have already integrated AI-powered imaging analysis, robotic assistance, or predictive analytics into your thoracic surgical practice? If you answer me this question, it will just highlight where we are actually in the adoption curve of surgical AI. And since I'm not here, you can just send me in the comments or shoot me emails. First, let's see what is AI. So, artificial intelligence represents machines' ability to mimic human cognitive functions, learning, problem solving, and decision making. Actually, in thoracic surgery, this translates to systems that can analyze complex imaging, predict outcomes, and assist in surgical procedures. So let me put this into historical perspective. The first medical AI application was Mykin in the 1970s, which was an expert system for diagnosing bacterial infections. Fast forward to today, and we have deep learning models achieving more than 94% of accuracy in longitudinal detection, which may help you, and actually surpassing radiologists' performance in early stage lung cancer screening. We defined AI, so let's move to AI subfields. Actually, AI encompasses multiple subfields relevant to thoracic surgery, which are machine learning, which enables pattern recognition in imaging. There is also natural language processing, which helps mainly with clinical documentation. There is an important subfield, which is computer vision, which mainly provides real-time surgical guidance. And finally, which all of you know, which is robotics, whom offers an enhanced precision during procedures. If you want to build AI, so you have to go through a process. So let me fly with you over the process. So we have to grasp mainly these six-step process. We start with data collection. Here we gather surgical videos, imaging studies, and patient outcomes. Then pre-processing, which involves cleaning and standardizing this data. Then model development, which uses algorithms to identify patterns. Validation ensures accuracy across diverse patient populations. Deployment, which integrates the system into clinical workflow. And finally, monitoring, which ensures continued performance and safety. Here you have to pay attention to your model so that it doesn't harm your patients and always you keep it relevant. Next, let's say that this brings us to critical questions, which is what represents the greatest implementation challenge for thoracic surgery AI systems. And actually, the answer is bias, as you may expect. And here we can say especially in your field, that bias is about data heterogeneity across different imaging protocols and variation in surgical techniques between institutions. And this challenge requires careful validation across multiple centers before clinical deployment. So if you want to deploy a model specific for example, for Mohammed Amin Dubai Hospital, you can't use data from the UK or the US. Okay, so you have to adopt these. Now let's dive into the AI applications. First, let's see the broader picture: AI in medicine. Now let's examine proven successes, which is Google's AI for lung cancer screen achieved 94.4% accuracy, analyzing low dose CT scans deployed at the Northwestern Medicine with 11% of reduction in false positives. Actually, this was published in Nature Medicine and validated internationally. Other breakthroughs includes here Viz AI's stroke detection system, now deployed in over 1,000 US hospitals, and IDXDR, the first fully autonomous AI diagnostic tool approved by the FDA. There's also the Alif Core's Cardiomobile, which demonstrates AI's potential in portable diagnosis for detecting atrial fibrillations. So here from robot intelligence AI in surgery, this may take more interest from you. And here we can say that surgical AI evolved from the FDA approval to the Da Vinci surgical system, initially robotic assisted surgery. Later, it was enhanced with machine learning for motion scaling and tremor filtering. And for the current innovations, it includes Surgery MML, a multimodal language model trained on surgical videos that assist surgeons in real time, suggests next steps based on prior cases, and documents surgery automatically, which may be a mess for you. Companies like Theatre, Care Syntax, and Proximi provide real-time AI in laparoscopic surgery, while Touch Surgery offers AI-driven simulation training using computer vision to identify surgical steps and alert the deviations from best practices. Since we don't have more time, I will dive into thoracic surgery quickly. Let's say that let's highlight that the breakthrough came in 2020 with Memorial Sloan Kettering's lung cancer AI, the first clinically validated AI for thoracic surgical planning. The system predicts optimal surgical approach, choosing between VATS versus open thoracotomy, and integrates seamlessly with Epic EHR systems for smooth clinical workflow. The current applications include 3D surgical planning AI from companies like Materialize and 3Mensure, creating patient-specific thoracic models. Predictive analytics now achieve 97% accuracy in predicting post-operative complications. Also, virtual bronchoscopy provides AI-guided navigation for complex airway procedures. For the intraoperative assistance during surgery, actually computer vision enables real-time anatomical structure identification during VATS procedures, and enhanced robotic surgery provides tremor filtration and motion scaling for delicate mediastinal dissection. Smart surgical instruments, including AI-powered staplers, optimize firing parameters based on tissue thickness. For the diagnostic excellence, we have the AI radiometrics analyzes CT features invisible to the human eye and predicting treatment response in lung cancer patients. AI actually bronchoscopy. The AI combines electromagnetic navigation with AI guided biopsy targeting, which is extremely interesting. Also, molecular imaging AI integrates with PET CT for precise tumor staging, which is actually a very important innovation in this field. Let's quickly move on to the post-operative monitoring. Here, in you all know that in post-surgery there is big work there. So here they invented ICU monitoring AI, which enables actually early detection of respiratory complications after thoracotomy. I think you may be interested in that more. And algorithms predict optimal time and forecast tube removal. Machine learning models provide personalized discharge planning based on individual recovery patterns. So, to sum up, this leads us to two main clinical implications. First, as we said previously, the preoperative planning and diagnostics, advanced AI algorithms which analyze multimodal imaging, and the second, the intraoperative assistance, the AI which revolutionizes thoracic surgery through enhanced robotic precision during complex mediastinal procedures, okay, which is assisted mainly by computer vision. So here's in Q&A. I'm so sorry not being there with you. It is for very, very extremely hard and foreseen uh, issues here I do have in the faculty. So if you have any questions, you can just shoot me an email. I will send it to you. I will share it with you, and or you can just comment, and I will try my best to answer all the questions. One last thing to add, I want truly to thank you all and to highlight something that in conclusion, AI in thoracic surgery is not a future possibility. It is actually a present reality transforming patient care. Okay, so I hope that we all take it into consideration so that we can boost our AI capabilities in our hospital here in Algeria. Thank you for your attention, and I'm more than happy taking your questions.